I have a long history dealing with cancer. Just like most people in the world, everyone knows somebody or they are a person that's dealt with an actual cancer diagnosis and therapy. People have friends, family members that have been dealing with this disease forever. And in my personal history, I've had 13 years of battling cancer with two parents that ended up dying within 3 years of each other. And so I had a particular interest in cancer therapies and treatment and was introduced to Dr. Wagner through a mutual friend who knew I had that experience with cancer and with that whole treatment. And so Dr. Wagner presented his treatment experience to me and my wife, and we sat there and listened to, for the first time, we heard that our bodies actually recognize cancer starts on a daily basis and are able to eliminate them. And that was phenomenal to me. So I wanted some way to participate in getting this therapy to people, but I'm not a scientist and I'm not a medical person. I didn't know how I could help or how I could really participate in that therapy. And because of the great experience and the great results that Dr. Wagner's had with his therapies, there was a possibility we could go to another jurisdiction and go through their regulatory process and see if we could get approval. And then if we got approval, then we could start treating patients in a very short order. So that's how I got involved. And when I heard that, and there was a possibility that a guy like me, just a business guy with no medical background or scientific background, could possibly help bring this therapy to the greater population, I couldn't resist. And we're not the only ones doing this kind of thing. Immunotherapy is becoming a top topic in the real general conversation around personalized care. So our story is, we're not the only treatment out there, the only therapy out there, the only way to do this. But if you're faced with that diagnosis, you need to think about traditional therapies, chemo, radiation, that kind of thing. And immunotherapy and personalized medicine needs to be one of those things that you consider as a credible alternative. And so when I started thinking about that from a business perspective, obviously, bringing that to a tremendous, huge population of people suffering with this disease, and bringing this therapy that has such great effectiveness, but without the side effects, without the inhumane side effects that our present cancer population deals with, I couldn't walk away from trying to get this to people.